So to continue what I was speaking about, which is the autoimmune disease in clinical practice or clinical births in autoimmune disease. Now I come to the categories of autoimmune disease. We have two major categories of autoimmune disease. Number one is the organ-specific autoimmune disease or diseases, the commonest examples of these diseases are the following. We have a Graves' disease, and the Graves' disease is autoimmune thyroid disease, which presents which is one of the causes of thyrotoxicosis, and it is due to the development of what we call thyroid stimulating immunoglobulin or anti-TSH receptor antibodies. That is, antibodies which the body form them against the receptors of the TSH receptors in the thyroid gland of the TSH secreted by the pituitary gland. So again, these are antibodies against receptors in the thyroid gland, on which the TSH secreted by the pituitary act on the thyroid to produce its effects in the formation and in the secretion of thyroxine. This is called the TSH receptor. The antibodies against these TSH receptors, these are the triggering factors for autoimmune reaction and autoimmune destruction of the thyroid gland, which may be first euthyroid. The Graves is just a pathology, but whether the thyroid is hyper or hypo, this is a physiology of the thyroid gland. So there is no link between the physiologic derangement of the thyroid and the pathologic affection of the thyroid. So Graves describes a thyroid pathology, but hyperthyroidism describes a thyroid physiology, exaggerated physiology, hyperfunction. And as we know, when we diagnose any thyroid disorder, we should diagnose it anatomical, physiological, and pathological. Anatomical means there is atrophy or enlargement of the thyroid goiter, and the enlargement, is it symmetrical or asymmetrical, is it nodular or not diffuse? This is anatomy. Physiology means hyper or hypo or AO function of the thyroid gland. Pathology, what is the pathological process in the thyroid which caused this anatomical change and which caused this physiological change in the thyroid function. Coming back to the pathology, which is Graves' disease. Graves is a typical example of an organ-specific autoimmune disease. And it is an autoimmune thyroid disease with inflammatory destruction of the thyroid gland, which may even end in thyroid failure, that the thyroid burns itself after a long period of being hyperactive and passing through a period of being euthyroid, as I mentioned. That is normal thyroid function. So Graves is an organ-specific autoimmune disease due to the presence of what we call the anti-TSH receptor antibody, or sometimes we call it the thyroid stimulating immunoglobulin, because this immunoglobulin, it stimulates the thyroid function and increases the secretion, the formation and the secretion or production of thyroid hormones, causing hyperthyroidism or thyrotoxicosis. That's why we call it Graves toxicosis. So Graves disease or Graves thyroid. Another example of organ-specific autoimmune disease is the type 1 diabetes mellitus due to antibodies directed against the beta cells of islets of Langerhans, directed against the islets of antibodies directed against the beta cells of islets of Langerhans which secrete insulin, they will destroy these cells, and so there will be insulin deficiency, and so the individual will develop type 1 diabetes mellitus due to insulin deficiency, due to destruction of this part of the pancreas responsible for secretion of insulin by specific antibodies formed inside the body due to the mechanisms which I explained before in the pathogenesis of autoimmune disease. So type 1 diabetes can be an example of organ specific, especially that one which develops in young people, and sometimes we call it juvenile diabetes, related to an autoimmune process. In Addison's disease, with formation of autoantibodies against the adrenal cortex, resulting in hypoadrenalism. Also, adrenal hypofunction. Addison can be an example of an organ-specific autoimmune disease with antibodies formed against autoantibodies formed against the adrenal cortical part responsible for secretion of steroids or corticosteroids and mineralocorticoids. Another example is the vitiligo in the skin is an example of organ-specific due to formation of antibodies against the skin, causing areas of depigmentation and vitiligo. So it's in the skin. In the nervous system, a common example is myasthenia gravis due to formation of antibodies against the neuromuscular junction. Also multiple sclerosis. So these are also patients with pernicious anemia due to antibodies against the intrinsic factor secreted by the parietal cells in the stomach, and this is usually associated with autoimmune gastritis also. So autoimmune gastritis with pernicious anemia due to anti-intrinsic factor antibodies resulting in B12 deficiency, and this is, we call it pernicious anemia. So in pernicious anemia due to anti-intrinsic factor antibodies is an example of an organ-specific autoimmune disease. So these are the categories of autoimmune diseases, the commonest categories of organ-specific autoimmune diseases.